EPA wants to eliminate a 2009 finding that greenhouse gas emissions are dangerous.
The agency says it would save $54 million annually if the proposal is finalized. But as Norman Seawright spoke with local leaders tonight, they say the move could have serious health consequences locally. He joins us now live. Norman, what else have you learned today?
Well, Rick, what I've learned today is rather interesting. I am in the Traeger microforest right here in downtown Louisville. We talked about this before. U of L installed this in May of this year. The university studies air quality all through downtown, which the American Lung Association says is still unhealthy. But the point of this study is to see how it cools the air in this particular spot and reduces air pollution. If the EPA rolls back these protections, installations like this could become much more important for public health.
It's the foundation of EPA's ability and EPA's responsibility to regulate climate pollutants like carbon dioxide and methane.
Shannon Baker is an advocacy director for the American Lung Association, which gave Louisville a failing grade for air quality in its 2025 report with pollution levels above the federal standard. She says worse air quality leads to warmer temperatures, more natural disasters, and worse health outcomes.
These climate-related disasters that we're talking about just have direct and profound impacts on our respiratory health.
Dr. Aruni Bhatnagar leads the University of Louisville's Envirom Institute, which studies the impact of environment on health. The newly planted microforest downtown is similar to its Green Heart project in South Louisville.
If chronic disease is the problem now, more than infectious disease, how do we create a city that is geared up to prevent chronic disease? And we think greenness is part of that.
He says there's evidence continued exposure to unhealthy air is a risk factor for heart disease, diabetes, dementia in older adults, and lower IQ in children. But even short-term exposure is a problem.
We have really good evidence that whenever levels of air pollution spike, 6 hours after that, levels of heart attacks spike as well.
Dr. Julia Richardson is a pediatrician. She says for the 10% of Kentucky's children with asthma, polluted air doesn't help.
Children are not little adults. Their bodies are different, their behaviors are different, the way that poor air quality affects them is different.
Dr. Bhatnagar says it's unclear if the EPA's proposal will mean more pollution.
There's nothing we can do about that. But what we can do as a community is to create resources that will at least in part mitigate the effects of these excessive exposures.
But Baker says rolling back protections would be irresponsible.
That decision would disproportionately impact those who are the most vulnerable in our communities, including our children and older adults and pregnant people.
A couple other interesting things we learned. Dr. Bhatnagar says there is a unique challenge for Louisville's air quality. We're sitting in a valley, which means air pollutants settle right here. And communities near freeways, near power plants, near factories, Dr. Baker says those communities are also at increased risk. Reporting live downtown, Norman Seawright, WLKY News.